Okay, so this is the drain, and it's round like this, but it's not supposed to be like this. After you empty out your drain, you're supposed to squeeze it tight so that it has negative pressure. And this, which is squeezed, is going to put suction in here. Now, another thing you also have to do sometimes is what we call stripping the drain, which means you're going to grab it with one finger near the patient's body. You're going to wet your fingers and then pull like this. And if you see it down here, it's pushing things down into the drain, and it helps drain some of the clots to come back if there's clots in the drain. All right, and after you do that, okay, you leave it like this under negative pressure, or with this wanting to suck the stuff up. But it's very important that you put the plug back on, and then you record the number in the paper. And you see here, I'm going to show you how to tell where the number is. You see this here had 25 cc's of drainage. So you empty this out and you write it in the piece of paper that we gave you. And now we put this stopper back on so it has its negative pressure.